Thank you, Mr. Speaker. Mr. Speaker, I rise in support of H.R. 6983, the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act of 2008. I'd like to acknowledge the hard work of Chairman Dingell, Rangel, and Miller, as well as Subcommittee Chairman Stark, Pallone, and Andrews, without whose unflagging commitment to this bill, we would not be so close to sending it to the President's desk. I'd also like to thank Speaker of the House Nancy Pelosi and our Majority Leader Steny Hoyer and the whole Democratic leadership for their consistent support in making this bill a top priority. I most would like to thank my good friend Jim Ramstad. Jim is leaving this year, and there will be no greater testament to his devotion to those with mental illness and substance abuse disorders than to see this bill signed into law by President Bush this year. I have a letter in support of this bill from former First Lady Rosalynn Carter, who has been such a champion for this issue, and I ask unanimous consent that it be inserted into the record.
Objection so ordered.
Mr. Speaker, we are bringing to the floor today a bill that is fully paid for, bipartisan, bicameral, and a compromise. A mental health parity bill that has long been coming to this floor. It is the result of extensive negotiations between the House, the Senate, and is supported by the chairman of the relevant House committees and subcommittees, as well as Senators Kennedy, Enzi, and Domenici. We cannot afford one more day without parity, because each day 5 United States soldiers take their lives because of suicide. We cannot afford one more day without parity, because each year $1.3 billion is lost because of those work days due to mental disorders, more than arthritis, stroke, heart attack, and cancer combined. The World Health Organization in this chart shows it's hard for anyone to really understand, but it's when you see it in this chart, you see it's the greatest loss.
Time is expired.
If I could ask my friend from Minnesota.
I yield the gentleman 2 additional minutes.
Gentleman's recognized.
If you look at the comparison in illnesses by lost days, burden of illness, mental illness is amongst the worst. Sure, cancer, sure, arthritis, sure, heart disease, but these are illnesses that capture people usually at the end of life. Mental illnesses, addictive disorders, really paralyze people from their beginning of life throughout their life. That's why it's such a burden of illness in our society. And it catches us in the Justice Department. Drug-related crime in our country costs us $107 billion a year. We cannot afford parity. We cannot afford not to have parity because 80% of our trauma admissions in our emergency rooms are alcohol and drug-related. And we cannot afford not to have parity because by denying an individual's treatment to their diseases, we are denying them the opportunity to live out their full potential and live a full and fulfilling life. Treatment works, as my good friend from Minnesota has said. It's worked for those who've had the opportunity to seek it. If you're a member of Congress, you have treatment opportunities. Like my friend from Minnesota said, he has had it, I have had it. Recovery is possible. We need to end the stigma against those with mental illness. But it isn't going to happen until we first outlaw the embedded discrimination in our laws. And that is what we're about to do today by passing this legislation. Simply cannot afford to wait one more day. And I yield back the balance of my time.
Gentleman yields back.